Hello, everyone. My name is Christy Colbreth, the DDA Statewide Coordinator of Self-Directed Services, and welcome to Part 2 of our Self-Directed Services Budget Sheet walkthrough, where we'll be sharing an example. Before we get started with this demonstration, please remember that this is an example. Self-direction and this budget sheet all exist for you to budget for exactly what you need. So please do not be alarmed if this example does not show everything that you might need or use. This is meant to be just an example to show how to use this budget sheet. While planning, it is best to have a few other tools ready at your disposal other than the self-directed budget sheet. So I have pulled up our self-directed services guidance forms and webinars website where you can find, really importantly, the DDA's reasonable and customary wages for employees, which I have pulled up here. And you'll also be able to see the reasonable and customary rates for vendors that I have pulled up here. We'll use those in a little bit when we're doing the budget sheet. It also might be important to include or to have readily available the FMCS monthly fees that can be found on our website under FMCS agencies. As a team, you may also want to gather any written human resources policies that you may want to apply to employees. And if you're using vendors, you may want to gather any written agreements that you have with those vendors. So today, for our example, I have a document sort of listing those details in one space so that we'll use that as we do this example. But it is okay if you don't have any formal written policies or agreements at this time. In the future, the DDA will be providing additional training to people who self-direct, their support brokers, and other team members on best practices to develop these tools. So let's get started with our self-directed budget sheet, first with the first 10 rows, which are just the details for the person. So for our example here, we have this person named Jay Doe. The effective date of this budget sheet will be July 1st, 2023, which is also the annual plan date for this person. So the budget sheet automatically calculates for 12 months per year left in the plan and 52.143 weeks left in the plan. Jay uses the Community Pathways waiver, and we are noting this as their annual PCP. And the detailed service authorization, the budget has calculated to $200,000. So we've listed that here, and it will automatically calculate how much we're spending as we create the rest of the budget sheet. So let's get started. Let's look at our sort of cheat sheet that I have here. I'll make it a little bit bigger. We know that for Jay Doe, the services needed today are FMCS, support broker, personal support, and Respite. They use Respite, and they use a vendor for Respite and support broker, and they hire employees for personal supports. So here, let's get started. Jay has chosen to use the ARC of Central Chesapeake Region, and they are currently, for 2023, charging $205 per month. So let's add that to the budget sheet. In the drop-down, we find the ARC Central Chesapeake, and here we'll list 205, and the total number of months will be 12. So that automatically calculates to $2,460. Now, the next service we need to include is support broker. So in our cheat sheet here, Jay has chosen to use ABC Support Broker Agency, and they charge $66 per hour, and they have agreed to provide 8 hours per month of support broker services as a vendor. So let's go to our support broker section. We're going to skip through initial orientation because this is Jay's annual plan. They've already been oriented to self-direction. And we're going to skip by ongoing staff because Jay is choosing to hire a vendor for support broker instead of a employee. So we'll go down to the vendor. 8 hours per month is what Jay has agreed to receive. That rate per hour is 66, and there are 12 months in this plan, so it automatically calculates to $6,336. Great. The next service that Jay needs to include is personal supports. So we'll go down here to employees and see some details that the team has worked out. So Jay needs a total of 60 hours per week of personal supports. That's what's in the person-centered plan. And they have 2 employees, S. McDonald and R. Reynolds, who provide those services. S. McDonald works full-time at 40 hours per week at $25 right now. But Jay wants to include in the plan a good evaluation raise up to $26.50. R. Reynolds works part-time on the weekends at 12 hours per day, right now at $22 per hour, but Jay wants to include in the budget sheet $23.50 so that when they're ready for evaluations, they can pay those rates. So they're going to budget at the rate that they want to provide during the year. So $26.50 and $23.50. Let's put in S. McDonald's wages and rates right now. So full-time at 40 hours per week. So we'll go to personal support staff. The total number of hours per week is 40. That rate that Jay decided is $26.50. And the total number of weeks in the year is 52.143. The other employee is at 20 hours per week at $23.50. Let's check it. $23.50, that's right. 52.143 weeks calculates that. Before we forget, we want to include taxes here at the bottom of personal supports. The ARC requires 14%, so we'll list 14% there. Now, let's move on to benefits. Jay wants to provide PTO, health insurance, and a holiday pay differential as benefits for their employees. So first, we'll look at the PTO policy. Jay's PTO policy is that there will be 2 paid weeks of PTO for full-time employees and 1 paid week of PTO for part-time employees. So I'm going to take that information as gathered by the team, and I'm going to add that first as a note in the benefits note section. This is an optional section, but it can be very useful for teams and the FMCS to see what's going on with the benefits. Now, let's look at the calculations. For a full-time employee receiving 2 weeks of PTO per year at that $26.50 rate would calculate to be $2,120. And for that part-time employee receiving 1 week of PTO at $23.50 will be $470 total needed in PTO. So those 2 numbers added together equals $2,590, and that is the number that we'll put in the PTO line item, 2590. PTO 2590. Taxes are automatically calculated. Now, health benefits. The health insurance policy is that there will be $200 per month reimbursement for any full-time employees. So that means there's only 1 full-time employee under personal supports, and there's 12 months in the year. So that means that $2,400 is needed in health insurance. So first, we'll add this note about health insurance listed here in the note section, and we'll add $2,400 to health benefits. Holiday pay differential. This policy for Jay says employees may need to work on 4 holidays per year. Employees who work holidays will be paid $2 more per hour. So that calculation is a little different here. So for that full-time employee, they're working 8 hours per day and they have the 4 holidays needed. And the $2 more per hour would be $28.50. So for total for that employee would be $912. But that part-time employee working 4 holidays, they work at $12 hours per day at the $25.50, $2 more than what they normally make. So they need $12.24 in that line. So those calculations all added together means that $2,136 needs to be in the holiday differential. So let's pull that up on our budget sheet. First, we're going to take the note and add it to the benefits notes, just so everything is clear. And I need to remember that number is 2136. Needs to go in holiday pay. And taxes are also already calculated. Jay does not live in Montgomery County, so they do not provide sick and safe leave, but they do want to provide some training costs. Let's look and see what they want. So the required training for personal supports for Jay would be first aid and CPR, and they want to allow for $100 per employee for training. So let's put that in the budget sheet. There are 2 personal support employees. So we'd list 2 there, and we'd add the $100 per employee for $200 for the year. All right. And the training hours needed for personal supports is 4 hours for first aid and CPR per employee, and then 2 additional hours per month for team meetings. So each employee will have 28 total hours. They have 4 hours for their first aid and CPR and 24 hours of staff meetings. So we're going to put 28 hours. Let's pull our budget sheet up. 28 hours for each staff. 1 staff, and we'll go back up to their rate, makes $26.50. And another staff makes $23.50. These are calculated automatically. Now, travel. The total needed for travel for this person, for Jay, is 50 miles per week at the federal rate of 0.655. So 50 miles per week at 0.655 for 52.143 weeks. And that calculates. We make sure that we have that taxes line that's being calculated. So there is personal supports for Jay Doe. Now, let's review what other services Jay needs. So we've done FMCS, support broker, personal support. Now we need respite. Jay chooses to use a respite care agency, XYZ Respite Agency, and they charge $28 per hour, and they know they need 50 hours per year. That's listed in their person-centered plan. So let's find respite. And they're choosing not to hire a provider, a licensed provider, not to hire a staff, but to hire a contractor. So they know we need 50 total hours, and that rate is $28 per hour. We don't need to calculate taxes. So here is an example of Jay Doe's budget sheet. Now you see that they've calculated their budget is $200,000 and they've allocated $112,000. So they have $87,000 in unallocated funds. They do not need to spend all of this money. They don't need to allocate it all, but they do decide that they also want to have a gym membership. So they want to include that from their individual and family directed goods and services. So they list it here. They want to go to the YMCA. And they know that the YMCA is $200 per month. And so $200 times 12 months is $2,400 that they would also include in their budget sheet. Additionally, now that they've included this in their budget sheet, they'll also need to complete the goods and services request form, and there'll be more information on that form in the webinar, in the Individual and Family Directed Goods and Services Guidance and Webinar coming up in June. Great. And so the total amount here that is budgeted is $114,835.14, which is well below their $200,000 allocated. That's been our example. There are many ways to use this budget sheet to provide the services that you need. If you have any additional questions, you can reach out to the DDA's SDS leads in each region or to myself, Christy Culbreth, and I can be found at Christina, Kristina, .Culbreth, CULBRETH, at maryland.gov. Thanks so much.